This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, June 3rd, and I'm Zach Caruso. Our lead story this week is from Scientific Reports and is titled Memory Function in Patients with Opioid Dependence Treated with Buprenorphine and Methadone in Comparison with Healthy Persons. This study compared memory performance in patients treated with methadone or buprenorphine for drug use to healthy controls using the Wechsler Memory Scale. Healthy controls performed better than both treatment groups in mental control. Methadone patients scored higher than controls in personal and general information, while buprenorphine patients scored lower in associate learning. Longer buprenorphine treatment was linked to better overall memory scores, and patients on methadone for over 2 years showed better awareness of place and time compared to long-term buprenorphine users. Overall, neither medication showed major negative effects on memory except for mental control, which was impaired in both groups. Buprenorphine appeared to better preserve memory function over time than methadone. A new article in Addiction is titled The Association of Perinatal or Caregiver Alcohol Use with Child Maltreatment, a Systematic Review and Meta-Analysis of Longitudinal Studies. This systematic review and meta-analysis of longitudinal cohort studies from high-income countries investigated the link between caregiver alcohol use and child maltreatment, expanding beyond previous studies that focused only on physical abuse. It found that caregivers with alcohol-related diagnoses had significantly higher odds of both new incidence and recurrence of child maltreatment compared to those without such diagnoses. While any caregiver drinking showed a possible association with maltreatment, the evidence was less certain. Despite some variability and limitations in the data, the findings suggest caregiver alcohol use is a significant risk factor for child maltreatment, highlighting the need for stronger measures to reduce alcohol-related harm. Next is an article in Annals of Epidemiology titled Examining Potential Bystander Presence for Overdose Deaths in Tennessee, 2019 to 2022. In Tennessee, between 2019 and 2022, there were 11,000 fatal overdoses. This study used data from the Tennessee Department of Health reporting system to examine the presence of bystanders during these overdoses. Overall, bystanders were present in 25% of cases and were less likely to be present for decedents over age 55 or in large inner cities. Most bystanders were family members, intimate partners, or friends. In addition to calling 911, bystanders performed CPR 27% of the time or gave naloxone 6% of the time. Since in 75% of fatal overdoses no bystander was present, the authors stressed the importance of not using alone. There is a need to raise awareness of the availability of naloxone since it was used in only a small proportion of overdoses. Next is a study in the Journal of Addiction Medicine titled Financial Well-Being and Impact on Alcohol and Mental Health Outcomes During the COVID-19 Pandemic. This study examined the relationship between financial well-being and alcohol use during the COVID pandemic. The study sample consisted of 250 individuals, 32% with AUD and 68% without AUD. A history of AUD had a significant interaction with a lower level of financial well-being. A lower level of financial well-being was associated with increased drinking and an increase in depression and anxiety. Those with a history of AUD were less likely to apply for financial assistance, which the authors speculate may result from an inability to fulfill daily tasks. They conclude that during periods of financial instability, there is an association between financial stress and alcohol use. Authors suggest efforts to improve availability of financial assistance to individuals with AUD and financial stress. Our next article is in PLOS ONE and is titled The Changing Role of Substances, Trends, Characteristics of Individuals and Prior Healthcare Utilization Among Individuals with Accidental Substance-Related Toxicity Deaths in Ontario, Canada. In this cross-sectional study, authors examined accidental substance-related toxicity deaths in Ontario between 2018 and 2022. Over the study period, the most involved substances were opioids, stimulants, alcohol, and benzodiazepines. Of note, there was an increase in the involvement of a combination of substances in deaths over the study period, particularly stimulants with opioids. Among the individuals who died, 60% had received a prior diagnosis of substance use disorder, and 19% had been treated for a substance-related toxicity in the year prior to death. These findings demonstrate the changing landscape of substance-related toxicity, specifically the increasing involvement of multiple substances, but also highlight potential missed opportunities to intervene with patients seen in healthcare settings. Next is a study in BMC psychiatry and is titled Exploring the Relationship Between Cue-Induced Craving and Withdrawal Craving in MUD Individuals Based on a Virtual Reality Cue Exposure Paradigm. Previous functional MRI studies showed different patterns of brain activation for craving associated with drug withdrawal and craving induced by drug cues. This study measured craving in 150 individuals with methamphetamine use disorder, or MUD, during withdrawal, and cue induced by images of drug and drug paraphernalia, and a virtual reality scene of actors using methamphetamine during a card game and inviting the observer to take a hit. The virtual reality drug use scene produced significantly greater craving than either withdrawal craving or the paraphernalia images. The withdrawal craving was positively associated with all the cue-induced cravings, suggesting a shared neurobiological mechanism. The MUD severity score was positively correlated with both withdrawal craving and cue-induced craving. Virtual reality can create complex and relevant cues that induce stronger craving than images of drug paraphernalia. Our next article is in Addiction Behaviors and is titled Global Burden of Disease Related to Tobacco Products and Trends Projected, 1990 to 2021. This study assessed the global disease burden caused by tobacco use from 1990 to 2021 using the Global Burden of Disease database. It found that deaths and disability-adjusted life years related to tobacco have increased annually worldwide, with cardiovascular and chronic respiratory diseases being the most affected. Males experience a significantly higher burden than females. Regions with a higher socio-demographic index or SDI levels saw greater reductions in tobacco-related disease burden, while low to middle SDI countries continue to suffer higher impacts. Projections to 2040 indicate that tobacco-related deaths and disease burden will keep rising globally but at a slower pace. Overall, despite some progress, low and middle SDI countries remain disproportionately affected. Our final article is in Addiction and is titled Long-Term Alcohol Consumption and Incident Health Risk Conditions Related to Cardiometabolic Risk Factors, a 20-year prospective cohort study. In this prospective cohort study over 20 years, authors examined the association between light, moderate, and heavy alcohol consumption and incidence of cardiometabolic risk markers. Overall, light, moderate, and heavy alcohol consumption was associated with increased incidence of hyperglycemia, high blood pressure, and hypertriglyceridemia. Moderate and heavy alcohol consumption were also associated with increased incidence of metabolic syndrome and abdominal obesity. Across all 5 risk markers, the associations were linear, with increasing incidence associated with increasing alcohol intake. These findings suggest that long-term alcohol intake, even when within guidelines, may increase risk of chronic disease, including cardiovascular disease. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.